Hi everybody, Adam Smith, Ultimate Bariatrics here, talking about balloons today. And no, I'm not talking about the ones you get at the fair or at birthday parties or anything about that. I'm talking about the ones that we put in your stomach. Coming out of this shutdown, whether everyone was staying home, we weren't going to the gym, a lot of people put on 25, 30, 35 pounds. So this might be an option for those people that really don't want a permanent weight loss operation like a bypass or a sleeve or a switch, but aren't being able to get the weight off with just diet and exercise alone, need just a little boost, a little jump shot. An intragastric balloon might be a good option for you. And we're going to toot our own horn here. We were the first people to put these balloons in North Texas. We were part of the FDA trial with the Orbera balloon, which is pictured here on the table, and I'll explain a little more about that in a little bit. It was pretty cool. We were approached by this company that made the band at the time, and they said, hey, we're making this balloon that we put in people's stomach to help them lose weight. It stays in about 6 months, and then we take it out. And I said, well, that's silly. As soon as you take that balloon out, they're going to gain their weight back. Well, in fact, that's not the case. What this does is it stays in long enough just to give you a jump start on that weight loss and get back to those healthy habits that you already knew you needed to use and utilize. You just weren't able to quite do them. So it's a pretty cool system. There's 2 balloons that are approved by the FDA. This is the Orbera balloon, and it's a silicone balloon that is filled with saline. Now, we obviously don't place that surgically. It's attached to this little thing here, an introducer. It's wrapped around the end of the introducer. It's placed into the stomach with endoscopic or EGD visualization, and then we fill it with saline. Once it's filled, this part detaches. There's a one-way valve that seals it. It stays in your stomach, and all it really does is it occupies space, like on this little model here. So it's taking up space in your stomach, so when you eat a smaller portion of food, you feel full and you don't walk around as hungry all the time. Now, the other balloon is called Obalon, and it's currently not available in the U.S. market. Their headquarters were in California, and the recent pandemic really affected them. We hope that they'll come back someday. That too was a good balloon, but we're really happy with this. And this was the first guy that really got approved for use in the U.S. I loved everything about this balloon. I think we do more balloons than anyone in the Southwest, as far as I know. I think there's only one group that does more balloons than us in the whole U.S., and that's up in New York, and they have a much higher population density than we do, obviously. So what was really cool about this balloon is they took us to Rome, Italy to be trained on the thing. So we went over to Rome, and what a trip that was. Huge hospital, multiple city blocks, great laboratory, practicing in the lab, and then live surgery demonstrations, or not really surgery, endoscopy. A great professor, Dr. Jinko was his name. He's like awesome, super smart, great doctor, been a pioneer with the balloon therapy. So these things, they stay in about 6 months, and then we go in and we suck the fluid out of them, they collapse, and we take them out endoscopically. Average weight loss, about anywhere from 25 to 50 pounds. That's average. So generally speaking, and there's a rule, the exception to every rule, the bigger you are, the more weight you lose. However, if you're really, really big, maybe a balloon isn't the right option for you. Maybe you should really consider surgery. But for people that don't want an invasive surgery, that need a jump start on their weight loss, a balloon is a really, really good consideration. Dr. Snow and myself do the majority of the balloons in the practice, although you can see any one of our 4 surgeons if you're considering balloon therapy. We've just had great success with this. This is not like a surgery. It's not altering your physiology. It's not altering your anatomy. It's not doing anything like that. You still have to put the effort in. You have to do the work. You have to do the correct diet. You have to exercise. You have to stay hydrated. You get part of the balloon isn't just throwing a balloon in you and saying, see you in 6 months. You meet with the dietitian and or the surgeon every month, either in person or virtually on televisit, to make sure you're on track, to track your progress, to make sure you're not having any problems. Now, the first couple days of this sucker aren't a whole lot of fun, let me tell you, because this is big. This is holding 500 cc's of fluid. If you ate something that was this big, your stomach would be upset. So the first day or two after this procedure, after this balloon is placed, you have a lot of cramping, quite a bit of nausea, quite a bit of heartburn. After about day 2, the stomach says, hey, I give up. This thing's here to stay. I'm going to accept it, and I'm going to leave you alone. I'm going to let you feel better. So that's the only downside of this thing that we've seen. We haven't seen a whole lot of complications. Of course, any procedure has risk and benefits, and you need to talk about those things with your surgeon or your doctor before you undertake any kind of medical procedure. But this is really starting to take off in our practice. We're really excited about it. We're really enjoying the patients that are doing this. But if you're interested, if you don't want an invasive surgery, if you're not interested in a permanent surgery, if you need just a little something to get you going, call us, talk to us, come in, visit us about the balloon, and we'll see if this is a good option for you. Otherwise, good luck, God bless, stay safe, hope to see you soon.